So if we could just maintain the momentum we've had so far, looks like we could just keep up our profits for over the summer.
But why don't we add a new product line now when it's slow, and then we could increase production in the fall?
No, not such a good idea. If I could just try, tell you.
George, what's going on? You keep rubbing your chest.
Oh, I don't feel so good. Oh, it's no problem.
Listen, George, I'm trained in first aid. Can I help?
Many people with an uncomfortable feeling in the chest don't want to believe that it could be a heart attack. If someone has signs of a possible heart attack, you must act and phone 911 right away, even if the person doesn't want you to. The first minutes of a heart attack are the most important. That's when a person is likely to get worse or even die. Also, many of the treatments for heart attack will be most successful if they are given quickly.
Yeah, I guess so.
Okay, tell me what's wrong.
It's just my chest feels tight. It feels like something is squeezing it. Oh, I'm starting to feel sick to my stomach. If I could just sit down for a minute, I'll be fine.
Alicia, phone 911. Tell them we have someone with tightness in their chest.
Got it.
And Joe, could you get the first aid kit and the AED? They're in the break room.
Yes, there's a man here. He's having tightness in the chest. He's sweating a lot and he's nauseated.
No, wait a minute. It's just some leftover heartburn. I just don't want to make a big deal.
Listen, George, do you have any allergies to aspirin?
No.
Have you had any bleeding lately? Have you ever had a stroke?
No, neither.
Yes, it's 8200 Bell Street.
George, I'm going to give you one adult dose aspirin. Chew that up and swallow it.
Okay.
We've just given him one adult dose aspirin.
Okay. Thanks.
Paramedics are on the way.
One of the main signs of a heart attack is chest discomfort. Most heart attacks involve discomfort in the center of the chest that lasts more than a few minutes, or that goes away and comes back. It can feel like uncomfortable pressure, squeezing, fullness, or pain. Discomfort may also appear in other areas of the upper body. Symptoms can include pain or discomfort in one or both arms, the back, neck, jaw, or stomach. Other signs of a heart attack include shortness of breath with or without chest discomfort, breaking out in a cold sweat, nausea, or lightheadedness. But what about the difference between a heart attack and cardiac arrest? We often hear these two terms used as if they are the same, but they are not. Sudden cardiac arrest results from an abnormal heart rhythm. This abnormal rhythm causes the heart to quiver so it can no longer pump blood to the brain, lungs, and other organs. Within seconds, the person becomes unresponsive and is not breathing normally or is only gasping. Death occurs within minutes if the person does not receive immediate life-saving treatment. A heart attack occurs when blood flow to part of the heart muscle is blocked. This blockage is caused when a clot forms in a blood vessel that carries blood to the heart. If the blocked vessel is not reopened quickly, the muscle normally nourished by that vessel begins to die. A heart attack can lead to cardiac arrest. If someone has signs of a possible heart attack, do the following. Make sure the person stays calm and rests. Phone 911, ask someone to get the first aid kit and an AED. If the person has no allergy to aspirin, no serious bleeding, and no signs of a stroke, have the person chew and swallow one adult or two low-dose aspirins. If the person becomes unresponsive, be prepared to provide CPR. Remember that during a heart attack, giving aspirin appropriately can make a big difference in the person's quality of recovery. Fainting may occur when someone stands without moving for a long time, especially if it's hot, has a heart condition, suddenly stands after squatting or bending down, or receives bad news. Fainting is a short period of time when a person briefly stops responding, usually less than a minute, and then seems fine. A person who faints usually gets dizzy and then becomes unresponsive. If you're asked to give first aid for a person who is dizzy but still responds, make sure the scene is safe. Help the person lie flat on the floor and phone 911 if the person doesn't improve or becomes unresponsive. If a person faints and then starts to respond, ask the person to continue to lie flat on the floor until he can sit up and feels normal. If the person fell, look for injuries caused by the fall. Phone 911.
This don't make sense. What is going on here?
Sarah, is it your grades? Are you trying to get those done?
Remind me when these are due. What time is it?
Is something wrong? You don't seem like yourself.
Diabetes is a disease that affects the levels of sugar in the blood. Too much or too little sugar causes problems. Some people with diabetes take medication, such as insulin, to maintain their sugar levels. But if a person with diabetes experiences low blood sugar, her behavior can change.
I haven't had a chance to eat lunch, but I've got to get these grades done.
Sarah, you need to eat. You have diabetes, right?
Yeah, I know.
Low blood sugar can occur if a person with diabetes has not eaten or is vomiting, has not eaten enough food for her level of activity, or has injected too much insulin. If low blood sugar occurs in a person with diabetes, the person may become irritable or confused, hungry, thirsty, or weak, sleepy or sweaty, or the person might even have a seizure.
Trudy, can you get Sarah some orange juice? She needs something with sugar in it. Sarah, would you feel better lying down?
No, I'll be okay.
Can you eat something and swallow? Trudy's bringing you some juice.
Yeah, I can do that.
Signs of low blood sugar can come on quickly in someone with diabetes. Take the following first aid actions. If the person can sit up and swallow, ask her to eat or drink something with sugar that can rapidly restore blood glucose levels. These items include glucose tablets, orange juice, or soft chewy candy such as jelly beans. If the person can't sit up or swallow, don't force her. Have the person sit quietly or lie down. If the person does not improve within 15 minutes, phone or have someone phone 911.